Okay, welcome everybody this afternoon to our webinar, or this morning, I apologize. This is Dr. Caitlin Padati with the Iowa Department of Public Health, and this is going to be an update on COVID-19 specific for our long-term care setting. So just a reminder, we're going to have everybody muted throughout the presentation, but please do go ahead and enter questions into the Q&A box. And we're going to be recording this session and it will be made available afterwards for reviewing. So I'm going to give you just a little bit of an update on COVID-19 activity. We're just going to briefly review what I think we've talked about before on CMS and CDC guidance. I'll give a little bit of a reminder on the request for enhanced surveillance or reaching out to us when you think you have a cluster of respiratory illnesses. And then I wanted to include just a few notes on ways that public health has been working with some of our long-term care partners, if needed, and then we'll go through some Q&A. So as I'm sure, many of you are aware, unfortunately, we do continue to see the reported cases of COVID-19 increasing around the globe, over 350,000 cases and over 15,000 deaths. Similarly, we've seen increases here in the United States, particularly in the past several days. The map you're seeing here is actually from Friday, I believe, but the CDC continues to provide updated national numbers Monday through Friday at noon. So we'll have some updated information nationally here shortly, but we have continued to see case counts increase here in the United States as well. And similarly, here in Iowa, we've continued to provide updates with a map and a little bit of demographics by age category and gender on our webpage, and those are being updated daily as well. And you can see here, as of yesterday, we had 90 reported cases from several counties across the state, and you can see our age categories still primarily in the adult, middle-aged adult, and older adult, and our gender breakdown here as well. And this information, again, will be updated on our webpage on a daily basis, and so that would be a good place to check for those kinds of additions. I did want to take a quick note to update on some of the questions that I think came up last week, and certainly if there are still questions, that we haven't addressed, please do feel free to enter those into the Q&A box, and we can, try and address those as we go along. I think there was a question about requirements for PALS or ACLS type certifications. Those would really be facility dependent, and so there's not necessarily a national or statewide standard that's been set with relation to those. So I would continue to work with your facility for any questions on that. I know that, there's been guidance from CDC, from the public health side, from us, as well as from DIA, from CMS, and sort of the regulatory side of things. And, we'll continue to provide some guidance that I'll walk through as well. But for more regulatory questions, DIA would be a good point of contact for that. And then I did want to clarify, we got some questions around the recommendation that was made over the weekend asking people to self-isolate when returning from out-of-state travel. And I think, that request was really related to people who had been traveling for spring break. And so it's not necessarily directed at people who, for example, might cross a state border every day as part of their work routine, particularly for healthcare workers. So again, that request was really a recommendation made to people who would fall outside of that healthcare worker group. I know that we spoke about this last week, and I'm sure many of you have seen this, but I wanted to include again just a note with a link to the CDC's document on mitigation guidance. I think these are all largely things that many of us are familiar with at this point. This includes things like the social distancing measures, particularly for our long-term care settings, the recommendations to do temperature and respiratory symptom screening and visitor restriction. But again, it's a good resource and it's available on the CDC's webpage. And again, just reviewing some of what I think we've already seen from CMS. This isn't new. I just wanted to include it again as a reminder, that visitor restrictions have been recommended, for non-essential personnel, canceling group activities and communal dining, and implementing active screening of people, particularly for fever and respiratory symptoms. And again, I know that there's been quite a few different pieces of guidance that are coming out. And, we're happy to hear about any concerns you may have and try and help you walk through those, particularly on the public health side. And then just also want to recognize, that we've been working closely and will continue to work closely with DIA for some of those more regulatory questions. Again, I think these are some topics that we talked about, but just as a reminder, for your facility, if you can, thinking about cohorting people who have symptoms of respiratory illness and designating staff to take care of those people, making sure that we have what we need to, use PPE in terms of signage, making the right types of PPE available and positioning disposal cans in an easy place. And also making sure that we're sort of maximizing the use of PPE where we can. I know that this has been and continues to be a challenge. And, in addition to sort of encouraging judicious use of the PPE and maximizing it when we can, we also do want to encourage you to continue to work with your emergency managers and reaching out through them if you have imminent needs regarding PPE. And then, of course, a reminder, and I know this has been challenging and hard for all of us as information comes out and changes, but opportunities to keep everybody informed, residents, their families, employees, I think are very helpful so that people understand what's going on and what we ask them to do and why we ask them to do these things, because we know that it can be hard when we do things like restrict visitation and that sort of thing. I did want to review some of our isolation recommendations for our essential services personnel. So these are people who are working in the healthcare, long-term care, residential settings. So likely, many, if not all of you on the webinar today. And so when we think about exposures that this group might have, there's a couple of ways since we've seen this virus activity expand. There's a couple of ways where that exposure could have happened. So, travel outside of Iowa for business or vacation, particularly to people who have taken a cruise anywhere in the world, living with somebody, being a household contact of somebody who's sick or who is a confirmed case, providing care for a patient who has had symptoms of COVID-19 or who has tested positive, particularly without, the right PPE, or being in close contact with somebody who, and that's more than 6 feet for more than 2 minutes with somebody who's visibly ill with symptoms. And so, the recommendations around essential services personnel, which again is likely going to include many of the people on the call today, is going to be that we're still going to, allow those folks to work as long as they remain asymptomatic and are monitoring their temperatures at the start and end of their shifts. And if they were to become sick at any point, they need to go home and self-isolate immediately. And when they're not working, they should try and stay at home and away from others for as much as possible for 14 days from their last exposure, which I know for many people working in these settings is going to be hard depending on how many symptomatic people you may be caring for. And if you're providing healthcare in a hospital, long-term care, pre-hospital, or residential care facility setting, we'd advise that you wear a procedure or surgical mask when you're providing care for patients if you're an essential services worker who has been exposed. And our recommendations for people who become sick or symptomatic are going to be that you need to stay home and isolate yourself from other people in your house. And you're going to want to do that for the following criteria. So we want you to have not had fever for at least 72 hours, so 3 full days without the use of any kind of fever-reducing medicine. And your symptoms should have improved for at least 3 days. And we want you to have had 7 days that have passed since the day that your symptoms first started. So I know that we briefly talked about this last week, and many of you have been reaching out, and we really appreciate that. And we hope that you continue to do that. Just a reminder that one of the things that we're asking is that if you're working in a long-term care setting and you've noticed 2 or more cases of respiratory illness among your residents or staff, we are asking you to reach out to us at IDPH using our 800 number. That's 800-362-2736. And the reason is because we want to help you, limit and address potentially ill people as quickly as possible. And so, we do things like, advising to, have people who are sick, especially staff, right, sent home immediately. We'll help facilitate collecting any necessary samples for you. And then also just reinforcing some of the activities that you may already be doing in terms of restrictions on visitation activities and meals. And then, we've gotten some questions about, wanting to prepare for if somebody were to identify a case in a resident or staff member, and what additional things, in addition to reporting and talking with us at Public Health, what sorts of things do we do? And so the things that we're doing are trying to determine when that individual started having symptoms, and using that date of onset, we want to identify staff and residents who would have been in close contact with that individual. We'd also, again, take the opportunity to reinforce considering isolating or cohorting exposed individuals using the essential service personnel guidance that I described. And we do have some templates in terms of communication that we can also share to help communicate some of those messages. And so I know that was sort of brief. I think we wanted to make sure that we had time to talk about questions. And so please do feel free to enter those into the question and answer box. And like always, this is certainly not your only opportunity to reach out to Public Health or ask questions if needed. So there's a question about, would level 1 dental masks be useful at all if needed? Yeah, I think if people have supplies, excess supplies of masks that they're able to provide, I think that would be great to consider. And so I think, one way to sort of route that would be to work with an area emergency manager, and we can facilitate what the most appropriate thing is to sort of receive and look at those. There's a question about homemade masks. It's a good question, and we are getting a lot of questions related to that, and I'm hoping that we'll be able to put out a little bit more of guidance broadly for people from that. It's an area that not just people here in Iowa are considering. And what we're trying to do are come up with a good understanding of, the materials and the appropriate uses for those. And so when we have that, we will be sharing that. There's a question about a dining room sort of setting, that it's divided into 2 settings right now, and that there's over 40 people in the dining room at a time, and should they stay in their apartment? Yeah, the recommendation really would be at this point to deliver the meals, to apartments, and to keep those high-risk individuals, older people with underlying conditions, to limit that interaction in a group setting as much as possible. There's a question about, are healthcare workers recommended to stay at the facility they're working at if there are active cases, and recommendations for visitors at end of life. Visitation, for end of life, the CMS guidance has been to really restrict or limit visitation except for around end of life care. And so that allowance has been made, and I think, that makes sense, and we just have to, be careful and that, as you're saying here, screen, any visitors who are coming in for temperature as well as respiratory symptoms. And that is the recommendation, that they be screened for temperature and respiratory symptoms. There's no current recommendation to put any PPE on any visitors, but anybody who's sick should not be allowed in the building. And in terms of the question about staying at the facility, I'm not sure if you mean if it's okay for them to keep working. It is okay for workers to continue working, while there are cases. They just have to, use the appropriate protections and, follow sort of the guidance to cohort people as much as possible and use the appropriate PPE. There's a question about, can you clarify when essential personnel working in long-term care facilities should wear a mask? Is that immediately? Essential personnel who have been exposed to a case of COVID, who have had a COVID exposure, are allowed to keep working but need to wear a mask when providing patient care. That's what the guidance around that is. There's a question about, is the recommendation if we have a staff member who may have been exposed? Yes, this is exactly right. So the recommendation is that if you have a staff member who may have been exposed, as long as they're asymptomatic, so they're not having symptoms, they can continue to work but should provide a mask when providing patient care. There's a question about the number of swabs to collect. I know that there's been a little bit of back and forth on that, and in part, some of that is because some of the testing around what's needed for COVID has been adjusted, but part of it is also we're sometimes trying to assess flu in addition to COVID, because we know that unfortunately flu is still circulating, and we do have tools like antivirals for flu that we want to use if we need to, and so we do continue to ask for the 2 swabs. And another question about number of swabs, and again, that's the reason for 2 swabs, testing for 2 different things. There's a question about where the template's located. We've been sharing the templates with the partners who have asked, but I think we can think about how we might be able to make that more widely available, and then whether we might be able to just post them on the website for you to use. That's probably the easiest thing, and we can do that. There's a question again about long-term care essential employees and when to wear a mask. The recommendation is that if you're a long-term care employee who's been exposed to a suspected or confirmed case of COVID, that as long as you're asymptomatic, you can keep working, but you need to wear a mask when you're providing patient care. There's a question about, are there recommendations for isolating residents coming from a hospital setting? There's not specific recommendations just for somebody who would have come from a hospital setting. I think that you're getting at something that's really important, right, is reaching out, and having lines of communication established between our long-term care settings and the acute, inpatient settings that we would refer our patients to, and coming up with how we're going to communicate, and plans around all of that. Because, again, when we take a step back and look at what's going on with COVID-19, the big picture here is that we've got a virus that's new, and that can infect people because we don't have immunity to it. The majority of people are going to have a mild illness, but it's our higher risk people who are going to have a harder time and who might need more care, in a higher setting. And so I know that that really involves the populations that you all work with. And so what we're trying to do is come up with ways to balance the healthcare needs of this population in the most reasonable and efficient manner possible. And so making those points of contact between, your long-term care residential settings and the area facilities to come up with, how things will move and how we'll communicate are going to be really important. And those are good things to do now and to continue to do as we move forward. There's a question about, should hospice staff be wearing N95s, or is a surgical mask okay for non-symptomatic patients? Yeah, so again, this is an example of where we want to make sure that you're reviewing the CDC PPE guidance, that we're using PPE when we need to, and that we're not using it when we don't. So we need to use personal protective equipment when there's somebody who is sick or who has symptoms, and the PPE is as much for protection of the individual as it is for preventing spread among individuals. So making sure that we're using masks when we need to care for symptomatic patients, and it's appropriate to use a surgical mask if you're caring for a symptomatic patient. Whether you suspect that they have a respiratory illness due to COVID-19 or something else, you want to use the right PPE. The N95 recommendation around COVID-19 has to do with aerosol generating procedures, so things like intubation and tracheal aspiration, or when you'd want to be using an N95 when you're providing that kind of care for an individual with COVID-19. There's a question about if symptomatic staff tested negative, does the 7-day criteria still apply? Yes, anybody who is sick with any respiratory illness should follow the 7-day criteria with 3 days fever-free and with improved symptoms. Across the board, the recommendation is going to be that anybody who has symptoms of a respiratory illness needs to follow that guidance. There's a question about residents in a dining room, only 2 at a table, with tables spread out and only healthy residents. Yeah, again, I think that what we want to think about is the fact that we know we've got higher risk individuals, right? Older people with underlying conditions. And the recommendation is that, those people need to be limiting their exposure to others as much as possible. So certainly, not being within 6 feet of others, practicing that social distancing, certainly adhering to the guidance of, not being in group settings of more than 10 people. Those are going to be the things that we want to follow, and particularly for our higher risk groups. And so thinking about how to do that in your facility, whether that means delivering meals to people or whether that means you can truly have people sitting 6 feet apart, that's going to be important to consider how it looks in your facility. There's a question again about swabs and the number of swabs, and the recommendation is going to be a swab for COVID-19 and a swab for flu. Yeah, so that's why there's 2 separate swabs. So the recommendation is still the 2 swabs, a nasopharyngeal and an oropharyngeal. Should a long-term care facility have test kits on hand, or do we just call if they meet criteria? Again, I think working with your area healthcare facilities, your area public health, to think about having swabs if you can, or where you would get them, I think that's a good idea. So, again, that's a great place where I would work with your local public health and with your area healthcare facilities to have, to think about if you can have a couple of those swabs on hand. There's a question about, taking new admissions, and I know that's a concern for a lot of people, and I know that's an area, where some of the guidance might be a little bit different in different situations. I think each facility, needs to look at their population, their workforce, and also, again, recognize that the big picture here is that we're really wanting to work together in our communities to find the safest and most appropriate places for our community members. And so working with, your area hospitals and area public health to come up with plans about what that is are going to be really important. There's a question about the CMS guidance for visitors in a facility for end-of-life situations who should use PPE. Yes, I would follow the CMS guidance on that. If one of our residents is involved with a low-risk exposure, do you recommend our employees wear a mask when entering that resident's room? As long as that resident, remains healthy, that's fine, but they need to be monitored very closely for symptoms. So as long as they remain healthy, I don't think that you need to implement the use of PPE, but we need to be watching those individuals very carefully. And they're an example of somebody who we should be, very closely screening for development of symptoms. There's a question about, do all employees need to wear a mask within 6 feet of residents? No. So the recommendation for use of masks is that if you're an employee who has been exposed to a suspected or confirmed case of COVID-19, and if you're asymptomatic, you're allowed to continue working, but you need to wear a mask when you're providing patient care. There's a question about swabs, again, because the swab can be used for both COVID and flu. Yes, we understand that, and our laboratorians are still requesting that we receive both of those swabs, and I know that this has been I know that this has been a hard area because it does continue to change, and so I appreciate that there are still questions about it. And so we'll continue to provide guidance in conjunction with our laboratorians as we move forward, but right now the request is still for both of those swabs. There's a question about, has the travel question been removed from screening? Yeah, that's a great question. So if you think about it, you know, unfortunately, as we've seen this virus move across the global community and the national community, you know, when travel was really important because epidemiologically, you know, it was one of the things that we were looking for in terms of exposure. Now that we've seen this virus, you know, spread in other areas, epidemiologically, it's not as important, right? Because we know that the virus circulates even here in Iowa, and so what's going to be more important at this point are going to be screening for the clinical symptoms, and you know, advising anybody who's a staff member who's clinically ill needs to go home immediately if possible, and self-isolate for the 7 days as we recommended, and that's the advice. There's a question, as long as residents are more than 6 feet apart, can more than 10 people dine together? Yeah, that's a great question. And so the idea around when you put a number on, you know, what constitutes a group gathering, the number of people is helpful in part, but so is the space that you're in. How far apart can people be? How long are they going to be in that space? What are they doing there? And do these people have underlying conditions? And so I think I would take all of those pieces of information into consideration when thinking about putting people in a given setting. But again, I think we have to keep in mind that the group that you all serve, that we're all working with and talking about here, are going to be our higher risk individuals. And so the preference is going to be that, you know, whenever possible, we keep them out of group settings. But if they're going to be in a setting, you know, absolutely adhering to the social distancing and group numbers is going to be important. And also making sure we're doing all the things that we do anyways, like cleaning our high-touch surfaces with appropriate cleaners frequently and all of those things. There's a question about, can you wear an N95 for a long period of time if you're having supply issues? So there is guidance around extended use for PPE, and the CDC webpage, you know, has some of that guidance, and I think that would be a good place to look for, you know, the appropriate and safe ways to extend the use of PPE. There's another question about, can staff work? Staff is okay to work unless they're having signs and symptoms with or without exposure. Yes, that's correct. So anybody who's sick should not be at work for any reason. Whether you're sick because of COVID-19 or flu or another virus we don't even know about, you know, if you're sick, you should not be at work. If somebody's been exposed and is asymptomatic, they can continue to work, but they need to wear a mask when they're providing patient care. There's a question about if a case is identified in a building, do the staff have to stay in the building? No. If a case is identified, it's not that we're asking everybody to stay in the building. If a case is identified, what we would do is immediately remove that symptomatic person, you know, or isolate them as quickly as we possibly can, right? So send that person home if there's staff, or, you know, isolate them to their own room, right? And then we'd ask questions about, when did your symptoms start, and we'd ask who you would have been in close contact with. And those are people who we'd need to follow up with to see if we can also send those people home or cohort them. But if in the course of doing that, we identify somebody who's a healthcare worker who is asymptomatic, they're allowed to continue to work, but they need to wear a mask when they're providing patient care. There's a question about goggles because of concerns around face shields and eyewear. You know, if you are out of eye protection, if you can work with your county public health and emergency manager to submit a request for eye protection, that would be important. And there's some guidance from CDC on ways to prolong use of current PPE on their webpage that might be helpful to look at as well. And let's see. There's another question. With common cold symptoms, sore throat, runny nose, no fever, does the 7 days still apply? Yeah, my recommendation is going to be that anybody who is sick with anything for any reason should not go to work. And that's the advice I would give year-round, whether we're talking about COVID or not. Any illness, anybody who's ill for any reason needs to stay home until they're not ill. Because when we do that, whether we're talking about norovirus or COVID or flu or anything else, we limit any virus or bacteria's ability to move to somebody else. And so my advice is going to be that anybody who's sick for any reason should go home until they're well. That's really the preference here. There's a question about, I think you're asking about a particular funding opportunity, and I'm not sure I have details to provide you on that, and I apologize, the individual who asked submitted it as an anonymous question, but if you want to follow up with the Department of Public Health or with your local public health afterwards, maybe we can see if we can get you a little bit more information on that. There's a question about staff asking if their badge would be good enough to let someone know if they're going to and from work if they're stopped. And I'm not sure if you mean if they're stopped like when they arrive at your facility, you know, but there's no reason, I'm not aware of any situation in which you'd need to be able to say that. But if you did, it seems like providing a facility identifying badge would be a reasonable thing to do. There's a question about if we can get test kits, how do we utilize them? So when we say the phrase test kits, I think sometimes there's a little bit of confusion. Sometimes test kit has been used to describe like the actual PCR materials that are used, for example, at the state hygienic laboratory or at a clinical laboratory to actually run a test. So that's not what we're talking about here. I think that what we're talking about here are just the swab and the tube that the swab would go into if you were going to swab someone. And so when we talk about providing test kits for a long-term care facility to have, for example, we're saying, do you need to have like a couple swabs available in case you need to use them? And that's, again, an example of a place where you'd want to work very closely with your county public health and EMAs and local healthcare to come up with, you know, how to make those kinds of things available. Okay, so I think that is actually all of the questions that we've received this morning. And again, as always, this is certainly not your last opportunity to ask a question. You know, we want you to encourage you to reach out to local and state public health. I can't tell you all enough how much I appreciate all the work you're doing, you know, and all the time that you're spending to stay up to date on this and to you know, to serve our Iowans here in a challenging time. And I did just want to let you know the letter templates I mentioned have been updated on our webpage under the long-term care setting. So that'll be something to look at. So again, thank you all so much for your time today. We'll continue to be providing information. Please continue to visit our website for updates, and please continue to reach out to public health, you know, as questions and concerns arise. Thank you all so much.